The EU's health regulator says it is reviewing the incidents, but suggests that there was no specific link between blood clotting and the vaccine. Lucy Hoff has more from Brussels.
Well, trouble began on March the 7th when Austria announced that it was suspending the rollout of a batch of the Oxford-AstraZeneca vaccine after it was linked to 2 cases of blood clotting. In one instance, someone who died, another who fell ill. That was then followed by Denmark, who even went a step further than that, announcing it was suspending the rollout of the Oxford-AstraZeneca shots entirely while an investigation is carried out over a 14-day period, and it will then review that decision. Saying that this is very much about being cautious, but clear concern that there have been some strong side effects from those who've received the jab. Other countries such as Norway and Iceland have followed that position taken by Denmark. However, the EU's health regulator, EMA, has said that the number of cases of blood clotting, which is reported to be around 30 cases in amongst the 5 million who are said to have received the AstraZeneca jab, is about normal for the general population, that there's no indication that these cases are necessarily linked with having received the jab, and that is advice that Brussels is following at EU Commission level. Here's EU Commission spokesperson for Health, Stefan de Kerschmacher.
We follow the science, which means in this case that we follow the advice and the opinion of the European Medicines Agency. The European Medicines Agency is following closely, of course, the use of the vaccines in the different member states. We will follow on this regard the EMA's assessment, which is, of course, better placed, having all this scientific framework to make this assessment.
This is the latest set of troubles to hit the rollout of the Oxford-AstraZeneca shot in Europe, which until recently was restricted in over 65s in many European countries, a decision that was later reversed in countries such as France and Belgium. There's also been an incredibly slow rollout of the jab here on the continent, in part to do with delivery shortages. AstraZeneca has slashed its delivery targets in both the first and second quarter, and the EU is now saying that it's not confident that AstraZeneca will even meet those lower targets in the first quarter that were already slashed by some 60%. Now, AstraZeneca has promised the EU that it will plug the gaps here through doses from outside of Europe, including the United States. But the EU has been told that on reaching out to the United States, it was told in no uncertain terms that there was no expectation that the US would be shipping any vaccines over to Europe, and that was not something that was likely to happen anytime soon. Lucy Hoff for SABC News, Brussels.